Good evening all, I'm Aditi Lamba with the Wednesday night edition of South Asian News. Welcome to Vision of Asia, the voice of our community. We are coming to you from our studio located in New York City. Here is what's happening tonight in the coronavirus pandemic. The nation reported a record more than 67,000 new cases yesterday, bringing the total number of COVID-19 cases to 3.4 million in the United States, with at least 136,000 deaths. As we try to grapple with these numbers, cases in the South and Southwest are soaring, with California, Florida, Arizona, and Texas as the new hotspots for COVID-19 spread. Earlier, these hotspots were here in New York and New Jersey. Top health official Dr. Anthony Fauci has called COVID-19 a pandemic of historic proportions, and there has been a new projection which predicts more than 224,000 deaths by November 1st. This comes as cases of coronavirus are skyrocketing across the nation. 38 states are reporting increase in the number of new cases, with at least 27 states pausing or rolling back their reopening plans. Several states today were seen placing mask mandates in public where social distancing cannot be maintained, and masks are being recommended by leading health experts and officials as an effective measure to control the spread of this virus. Also, on masks today, world's largest retailer, Walmart, announced that it will require customers to wear masks starting next week. This will be mandated in over 5,000 of its stores in the United States. While this is happening, debate continues over schools as back-to-school dates draw closer, with Los Angeles and San Diego announcing that schools will not open for any in-person instruction starting August. Same was announced by the city of Atlanta as well. Here in New York, Governor Cuomo has said that the final decisions on reopening schools will be made next month. If you are a South Asian educator or a member of the school board, connect with us on your opinion and your perspective on schools reopening while the nation sees a surge in cases. Connect with us on events@itvgold.com. Also, calling all South Asian medical professionals and frontline workers to share your experience and your story with us. You can also reach us on Facebook at ITV Gold. With that, it's time to take a look at the stories for the evening, covering much on COVID-19's impact and measures. Here are the headlines. Fashion designer Harleen Kaur addresses COVID-19 impact on fashion industry, New York City. Dr. Vandana Agarwal on coronavirus pandemic updates, measures and advice, California. Asia Society presents On the Frontline, India's Community Health Soldiers panel discussion, New York. A lot more on the other side of the break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I'm Aditi Lamba, and this is Vision of Asia Wednesday night episode. Starting the show tonight, we are looking at the ongoing economic and health ramifications of COVID-19 on a spectrum of industries. One of those affected is the fashion industry, which globally has been severely impacted by government shutdowns of manufacturing plants, event cancellations, and through store closures. This is happening while consumer demand increases, presenting many challenges for fashion brands across the nation who have had to resort to e-commerce as a platform to reach its consumer market. Bringing much perspective on the impact of COVID-19 on the fashion industry and measures on the brands have had to take to protect themselves and their clients, we spoke with popular New York-based Indian-American fashion designer Harleen Kaur. Harleen discussed much on the transformations in her company since the shutdown and the uncertainties of small businesses during the pandemic. Harleen Kaur also highlighted on the importance of incorporating masks in her label, with masks for beards and turbans and members of all age groups. Here is Harleen Kaur. Okay, great. Harleen, Kaur, thank you so much for being with us here on ITV Gold. I hope you're doing well today.
I am. Thank you for having me. I hope you're well too.
Yes, of course. It was so important to have you on the show with us because it's important to discuss what is happening with the fashion industry while we're looking at COVID-19. So just starting this interview off, I have to ask you, if I was to, say the impact of fashion industry has been transformative, I'm sure you would agree with that. But what has been your personal experience with COVID-19 and having a brand which has to go across everywhere?
Yeah, so we actually opened up our New York City showroom just last year in September is when we moved in, and we were just getting everything set up to launch that showroom for appointments and everything. And then COVID-19 happened, of course. So for us, it's been a little difficult in terms of getting people in for appointments because obviously we were shut down for, you know, like 3 months. So it kind of negated the need, I guess, for having that showroom. So we were having to do a lot of virtual consultations. A lot of our customers are brides and grooms who decided that maybe they are going to go forward with their wedding, just do a civil ceremony, very small, intimate, and then next year they're thinking like doing a bigger event. So those customers were still trickling in very little, but of course all of the people that were buying for the weddings and events were obviously non-existent because those events weren't happening anymore. Luckily, we do have a good customer base overseas as well. So we were getting a few orders from there, and then we realized there was a need for masks, so we started doing that. It's just been a lot of pivoting here and there, according to what's needed and what the industry is looking for.
Yes. Harleen, you produce everything in the United States. Actually, you work out of the New York Fashion District, which is really popularly known. How has everything been impacted in terms of your production and your sales? And when you're looking at these factories that were making your outfits, how has that relationship changed? What did you have to do in order to make sure that your outfits are being made and the production continues to stay on?
Yeah, so obviously the factories were closed for March, April, May, and then I believe June was when they were able to start opening at a limited capacity. Fortunately, our factory was actually able to start making PPE, so they were running at a very limited capacity making PPE even before phase one started. So they were operating, and they kind of, although they weren't doing clothing, they were able to kind of get into the rhythm of opening at like a certain capacity, having all the precautions, or taking all the precautions rather within the factory, people wearing masks, socially distancing. So they kind of had that down at the point when phase one started, and we were able to start producing our garments. So luckily for us, that wasn't really an issue, and they've been really good about getting all of our stuff to us on time. Of course, the other designers that produce with them have also been hit. So their, production has significantly gone down, as has ours. So everybody's kind of struggling to just stay alive. As far as I know, a lot of other factories and garment industry companies that are within the New York City area have been struggling with the same thing. So everybody's kind of just trying to make the best of what's happening. And fortunately, even though they are working at a limited capacity, they're able to get our stuff our custom orders and our urgent orders out on time.
Yes, I know when things were closed, of course, it was a difficult time period for all small businesses. But my question to you now would be, when the lockdown is over, you're going back into production, there's a lot that's happening. What are some of your biggest challenges right now as a fashion designer who is producing from the US?
Yeah, so some of our biggest challenges right now are just that, the US is spiking in cases again. Of course, New York is still doing pretty good, but the southern states Texas, Florida, Arizona, those are all climbing. So, events are definitely going to be affected within the US for the next few months. So, trying to figure out what we can do to kind of sustain ourselves for the time being. We started doing masks. The ones for the beard are doing really, really well for us right now. So we're hoping that that continues as people are taking the precautions that they need to while going out. It's just, I think, going to be about, assessing the situation as it comes because, a month ago, we didn't know where we were going to be this month. A month before that, we didn't know where we were going to be that month, right? So everything's changing so quickly, and I think it's just going to take a lot of time and just it's going to take a lot of time and energy for us to keep going and figure out what to do next.
Right. While you're sort of, analyzing the situation as an entrepreneur, my question to you here would be, when we're looking at, there's being mask mandates throughout the country in various states. Over here in New York City, everyone's obviously been pushing for wearing masks, protecting ourselves. You invented a really interesting mask which goes on for beards, and it's very friendly for South Asian Americans. Could you give us an insight into exactly what the mask is and, a little bit insight into what inspired you to create these looks?
Yeah, so as you know, actually, I am married to a Sikh Sardar. So he has a long beard and he wears a pagdi. So, of course, within the quarantine, he wasn't really wearing his pug that often because his work was also shut down. But he had issues with, those general disposable masks going over and covering his body. So, that was definitely an inspiration for it. And then also, I had so many family members who did have to go to work because they had essential jobs and they were tying bugs to work and they couldn't get the strings of the mask to actually go around their bug because they were too short. So they were makeshifting them. They were cutting them and tucking them into the bug, and it seemed like such a hassle, and it just wasn't effective, right?
Yeah.
So I did a few iterations of this beard mask. I tried a few. My husband was the guinea pig. He tried on a few of them, and then finally we came to, one that we really liked, and then we went forward with it. So initially I started just making them for some family members, and then they loved them so much that they had other people who were interested in them as well. So then we started producing them, and it's been really, really, the response has been really good, and we're actually in the process of donating some to some gurdwaras and some other nonprofits that do work in the New York City area. But we just haven't been able to keep them in stock enough to do that yet. So hopefully we have another bigger round of production coming in next week. So we're going to be able to actually donate more than what we initially planned.
Looking at the coronavirus pandemic updates, measure and advice, we have now a conversation with Dr. Vandana Agarwal, who joined us earlier today from California. The state is now one of the new hotspots of COVID-19 cases, with the state reporting its highest second single-day increase in cases and deaths today, with more than 11,000 new COVID-19 cases, with many hospitalizations and intensive care unit admissions in California reaching its capacity. California in total has more than 347,000 cases, resulting in more than 7,000 deaths. Yesterday, Governor Newsom ordered all counties to close indoor services in many locations such as restaurants, movie theaters, bars, and many others. While this is happening, cities Los Angeles and San Diego have announced that their schools next month will be conducted by online instruction only. Bringing much perspective on this, Dr. Vandana Agarwal addressed the importance of social distancing, wearing a mask, and washing hands. She also discussed much on the ongoing vaccine trials for COVID-19. Here is the conversation. We're looking at 3.4 million cases in the United States of America with 136,000 deaths. So my question to you has to be this. Did these states across the country reopen too fast? And the spike that we see in this case number, is that a direct result of these reopenings?
I don't believe so. The reason it cannot be just attributed to reopening of states too early, it is because they're doing more testing right now. So that has contributed to the increasing numbers.
Oh, gotcha. And in terms of looking at these other states now, do you think they should shut down in order to perhaps contain the spread of the virus? How should they be handling this right now?
Handling is very tricky. First of all, the most important is social distancing. Just like in Sweden, every citizen of Sweden is disciplined. So we have to maintain social distancing. And obviously, if one is sick with cough, flu, headache, fever, one should not go out and should have the decency of self quarantining. But proper hand washing, not rubbing the eyes or the nose uh, is important too. And wearing mask is necessary, but you know, I don't know if it is really protecting.
Interesting. That's a very interesting opinion on that. Let's talk a little bit more about California, since it's one of the states that's showing a huge spike of cases, and you're joining us from California. Talk to us about the conditions of hospitals and clinics in the state right now. What is the condition of PPE supplies, ventilators, hospital capacity, ICU beds? Is there enough material for a spike in cases if it keeps on increasing?
Yeah, majority of the spike in cases are not as virulent and requiring hospitalization as the early on cases. And in my neighborhood, all hospitals have designated beds for COVID in ICU as well as otherwise. All the county societies, Los Angeles County Medical Association, Riverside County Medical Association, San Bernardino County Medical Associations are all donating PPE to doctors and their offices. Our clinics are not flooded with COVID at all.
Oh, wow.
Yeah.
So when we keep on hearing about these spike numbers and these increasing numbers, you're saying that you're not seeing them as much in your clinics.
Oh, not really. Not really. Even patients are not complaining. And testing is very simple. Go to the lab with a doctor's order and they will do it.
And let's talk about testing a little bit here. There's two kinds of testing, one for to determine if you have COVID-19 or not, and another one is for the antibody testing. Could you tell us about what is happening in California in terms of these testing, and do you think there's enough testing available right now?
I believe there is enough testing because there are not only some sponsored by CDC and local county societies where they are doing it in parking lots and elsewhere, but the labs also. There are several labs who are doing it. One is the testing for the virus itself, and the second is for the antibody. And I haven't seen anybody being turned off or turned away from getting these tests. Originally, yes, they were only doing it for symptomatic patients or if you were exposed, but not anymore.
Do you recommend us to all get antibody testing? And I'd like to get your opinion on antibody testing as well. How efficient do you think it's going to be in the long term?
Antibody testing is, what I understand, tests if you have been exposed to the virus and if you're immune to it. 40 to 60% of them who have been, there is a 40 to 60% chance that this may be false negative. That means if you were exposed and had the virus, you may still be negative. And even if you're today positive, you may become negative the next week or the following week, as was illustrated in the study published in Lancet.
Interesting. And from there, I'll have to ask you about treatments and drug trials and the vaccination. There is so much in news about what is happening in all those terms. We have heard various medications throughout this entire process that doctors are testing. What could you give us, on that? And how important do you think it is for us to get this vaccine by the end of this year or next year?
Okay. Vaccine, has to go through animal trials, phase 1 to see if it is safe. Then you go to phase 2 to see what could be the standard dose or the effective dose, and then you go to phase 3, and it requires time. Right now Moderna has come out with only phase 1 trial. To come out with an approved vaccine is going to take at least 18 months, in my opinion. If they do it sooner, I don't know whether that is realistic.
It's time for a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. This is Vision of Asia, the South Asian news segment, and I am Aditi Lamba. Looking at the impact of coronavirus pandemic in India and its community now, we have highlights from Asia Society's recent web event titled On the Frontline, India's Community Health Soldiers. The panel discussion saw experts discuss the role of community health workers and community participation in health systems for early detection, diagnosis, and treatment of coronavirus in India. Donning multiple roles, these healthcare workers act as intermediaries between public health officials and the community. The virtual event featured a dialogue on providing medical services to the most vulnerable areas and what is India doing in community health outreach in the world's second most populous nation. Here is the story.
So today, what we are trying to do is to talk about the community service program that India has in place in the cities and in areas.
When we look at the health system of the state, we generally think of hospitals. But health system, as you know, is much bigger than hospitals. And if you are not invested in those aspects, the health system resilience, which is a measure of how well a system responds to a shock, and how the essential things are carried out, will get affected. So what you will see would be states that have invested in hospitals are certainly important, but areas like surveillance and so on, they will do better. When I look at the health systems and the resilience of health systems, there are two dimensions in which I think we need to look at these things. One is internal to the health system. The other one is external. Let's deal with the internal part. Internal is when, how good are your systems, how good is your surveillance, how good is your procurement, what's your HR capacity, infrastructure, and there are some other, not so tangible ideas like, morale of the workforce, the delegation of powers and so on. All this generally get revealed during such times. And I don't want to take names of states, but if you look at the way states have responded, you will see that these have influenced how they work things. But what's also important is that, and when you look at when the most important failure that I've seen is in the surveillance part, in terms of tracing and tracking and quarantining. I have argued that if states had done this, you would not have seen this kind of booming of the epidemic. Because look, we had our chances. We got 3 months notice. We had the other countries had shown how this is going to happen, and this virus was coming from a certain set of epicenters. And I believe the health systems of most states, I attribute that to the lack of public health awareness or public health focus. Since we knew the epicenter and since the virus was coming from a certain region, we had a golden opportunity that was, I'm sorry, but frittered away. The advantage Kerala had was that we'd been through this before, and people knew the danger that was there. But there's another very important thing that going forward we have to be careful about.
Well, this wraps up our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.